First fact: the human brain weighs about 1.3 to 1.5 kilograms, which is approximately 2% of body mass, but it requires disproportionately more energy. At rest, it consumes about 1/5 of all oxygen and glucose. This high energy demand is explained by continuous electrical activity and the costs of maintaining ions across neuron membranes. The organ is protected by several layers: the hard skull bone, 3 membranes, shock-absorbing cerebrospinal fluid, and the blood-brain barrier, which allows nutrients to pass but prevents blood from directly contacting brain tissue. Importantly, the brain itself has no pain receptors. Neurosurgeons can operate under local anesthesia, and the patient does not feel pain in the cortex. We perceive pain due to receptors in the membranes and blood vessels, not in the neural tissue. The second fact states that the brain contains approximately 86 billion neurons. Additionally, there are likely several times more glial cells, such as astrocytes, oligodendrocytes, and microglia. Neurons connect through millions of billions of synapses. Estimates range from hundreds of trillions to a quadrillion contacts. This network is dynamic, with contacts strengthening, weakening, disappearing, and reappearing. Myelin, which oligodendrocytes use to insulate axons, allows signals to travel at speeds of tens and, in larger fibers, up to about 120 meters per second. Astrocytes regulate the chemical environment, redistribute energy, and participate in signal transmission. Microglia, the immune system of the brain, constantly patrols the tissue, clearing debris, including synapses slated for removal. This is not just wiring and maintenance, but a living city with its own infrastructure. Fact 3: plasticity is a fundamental property of the brain. It changes under the influence of experience at all levels, from synapse strength to cortical maps. Long-term potentiation and depression are mechanisms by which connections are strengthened or weakened with coordinated activity. Maps of the body and sensory inputs are reorganized. If a musician's finger is loaded with years of practice, the cortical representation of that area expands. In navigators, according to several studies, the posterior hippocampus associated with spatial memory increased. In adult humans, the issue of neurogenesis remains debatable. In animals, it is confirmed, and in humans, many studies find its traces in the hippocampus, but the extent and functional role are disputed. It is important that plasticity is not a privilege of childhood, but a lifelong resource, although with age, the cost of changes increases. Fact 4: popular myths about 10% of the brain and left-brained artists do not hold up to scrutiny. Neuroimaging and clinical observations show that all brain areas are active throughout the day, simply with varying intensity. Disable a small zone, and a deficit will appear. Functional asymmetry exists. Most right-handed people have left hemisphere dominance in speech tasks, while the right is often stronger in spatial processing and intonation. But these are not two characters, but a closely connected system linked by the corpus callosum. Creative and logical operations are distributed across a network of nodes in both hemispheres. Individual differences are large, and learning can change the balance of hemisphere involvement depending on the skill. Fifth fact: sleep is not an off switch, but an active repacking and cleaning process. During the slow wave phase, cerebrospinal fluid exchange intensifies, and the so-called glymphatic system operates. Intercellular channels widen, and metabolic waste products, including excess beta amyloid, are cleared more effectively. At night, the brain reprocesses daily activity patterns, which is linked to memory consolidation. Facts and skills are strengthened, unnecessary connections are pruned, and useful ones are stabilized. Sleep deprivation impairs attention, decision-making, and emotional regulation, while chronic sleep deficiency is associated with an increased risk of metabolic and neurodegenerative disorders. Caffeine can mask sleepiness by blocking adenosine receptors, but does not compensate for the actual sleep deficit or the accumulated errors in synaptic editing. Fact 6. Electrical impulses in the brain are converted into chemistry at the axon terminal. Mediators are released into the synaptic cleft, which bind to receptors on the neighboring cell. The main workhorses are glutamate, excitatory, and GABA, inhibitory. They are joined by modulators, dopamine, serotonin, acetylcholine, norepinephrine, which do not so much trigger a signal as tune the sensitivity of networks and the noise-signal ratio. The same mediator acts differently depending on the receptor type. For example, glutamate AMPA and NMDA receptors have different temporal properties, influencing learning. There is also volume transmission, when the mediator diffuses around and affects neighboring synapses. The fate of the molecule, rapid breakdown by enzymes or reuptake into the terminal, finally regulates the duration of the effect, and errors in this cycle affect attention, mood, and motor control. The seventh fact is that memory is not formed in layers like an archive, but is reconstructed by a network of areas. Episodic memory relies on the hippocampus, which acts as an index connecting event details. Semantic memory, on the other hand, uses distributed zones of the cortex where word and fact meanings are stored. Procedural memory, or skills, is strengthened in the basal ganglia and cerebellum, where prediction errors refine movements to automaticity. Working memory, a buffer for seconds, depends on the prefrontal cortex and its connections with sensory areas. Forgetting is not a malfunction but an economy. Connections that are rarely activated weaken. Meanwhile, memories are plastic and prone to distortion, as seen in experiments with false details. Smells easily bring back past scenes because olfactory pathways are directly linked to the amygdala and hippocampus, bypassing the thalamus. The eighth fact is that the brain develops in waves. Initially, the neural tube forms. Then, neurons migrate along radial forests of glia, creating cortical layers. This is followed by a surge in synaptogenesis and years of pruning excess connections. Adolescence is a time for restructuring prefrontal networks for self-control and risk assessment, biologically explaining impulsivity and novelty-seeking. Critical and sensitive periods allow vision, hearing, and speech to tune in to environmental inputs. Insufficient stimulation during these windows leads to lasting deficits, while a rich environment accelerates functional maturation. Learning can temporarily unlock plasticity in adults, especially with focused practice and sleep. Risk factors like maternal iodine deficiency, alcohol, and lead interfere with the building plan, making prevention and early intervention disproportionately rewarding. Fact 9. Pain is not just a signal of damage, but the result of communication between ascending and descending pathways. Expectation, fear, and attention can intensify or reduce the sensation. Placebo activates the body's own opioid system and structures like the periaqueductal gray matter, while nocebo, conversely, increases suffering through anxiety. The amygdala colors pain with the emotion of threat. The insular cortex is responsible for the bodily aspect of the experience, and the anterior cingulate cortex handles the motivational component, to endure, flee, or ask for help. Chronic pain alters network sensitivity. Neurons learn to react to smaller stimuli, and the body map can become distorted. This explains the effectiveness of multidisciplinary approaches, movement, cognitive techniques, sleep, which recalibrate the system from top down rather than just dampening the peripheral signal. Fact 10. The cerebellum is known as the conductor of movements, but its role is broader. It builds predictions about the sensory consequences of actions and compares expectations with reality, minimizing error. This scheme is suitable not only for motor skills, adapting to prism glasses or precise speech articulation, but also for cognitive rhythms. Timing, smooth attention switching, and even the rhythm of thought improve with the harmonious work of the cerebellum with the frontal lobes. Damage leads to movement dysmetria, misses, tremor, and to thought dysmetria, Speech fluency, planning, and tempo are disrupted. Hundreds of thousands of mossy and climbing fibers connect sensory and cortical inputs, and Purkinje cells, the sole output of the cerebellar cortex, finally dose the inhibitory flow. Thus, the cerebellum turns noisy signals into a precise behavioral metronome. Fact 11. The blood-brain barrier is not a wall, but a finely tuned border control. Its foundation is made up of endothelial cells of brain capillaries, held together by tight junctions. Pericytes and astrocyte processes are pressed against these junctions, and together they decide what to let in and what to immediately expel. Glucose passes through the GLUT1 transporter, some amino acids through systems like LAT1, iron via the transferrin receptor pass, and lipophilic molecules can slip through by diffusion. Efflux pumps, such as P-glycoprotein, push unwanted substances back into the blood. There are exceptions. Circumventricular zones, subfornical organ, subcommissural organ, pineal gland, where the barrier is weaker and the brain samples the blood composition. In clinical practice, the barrier complicates drug delivery. It is temporarily opened osmotically with mannitol or with focused ultrasound and microbubbles. During inflammation or ischemia, it becomes leakier, changing the disease picture and the response to therapy. Fact 12. The brain communicates through rhythms. Electroencephalography records delta waves during deep sleep, approximately 0.5 to 4 Hz. Theta waves, involved in navigation and hippocampal encoding, operate around 4 to 8 Hz. Alpha waves in the occipital region at rest are between 8 and 12 Hz. Beta activity, associated with maintaining a state, ranges from 13 to 30 Hz. Gamma oscillations, accompanying feature binding and detention, are above 30 Hz. These ranges are not strict channels, but useful labels. How areas synchronize is more important. The phase of a slow wave can carry the amplitude of a fast one. Theta-gamma phase amplitude coupling in the hippocampus correlates with long-term memory. Suppression of alpha in the cortex enhances processing in a chosen visual field location. Excess beta in the basal ganglia accompanies motor stiffness. MEG captures magnetic traces of these same rhythms with high millisecond precision. Epilepsy is an example of hypersynchronization. A network gets stuck in a pathological unison, turning the rhythm from a coordination tool into a whip. Fact 13. Dopamine is not a pleasure hormone, but a prediction error signal for reward. If the reward turns out to be higher than expected, neurons in the ventral tegmental area fire more frequently. If lower, they become suppressed. This is how the brain adjusts the value of actions and stimuli. There are several pathways. The mesolimbic pathway leads to the nucleus accumbens and modulates the motivation to seek. The mesocortical pathway influences prefrontal evaluation of options. And the nigrostriatal pathway, running from the substantia nigra to the striatum, is critical for habit learning and movement precision. Its degeneration underlies Parkinson's disease, slowed movements, and tremor. L-DOPA temporarily compensates for the deficit but can cause dyskinesias. Psychostimulants interfere with dopamine transport, DAT, amplifying the signal, while drugs indirectly boost the probability of better than expected, reinforcing behavior. The difference between the tonic motivation background and phasic surprise spikes is important, as it determines the propensity for exploration and persistence. 14th fact. Language is a network, not just 2 points, Broca's and Wernicke's areas. The ventral stream, temporofrontal connections, matches sounds with meaning, while the dorsal stream, via the arcuate fasciculus, links sounds to articulation and working memory. Broca's area in the inferior frontal gyrus is important for syntax and speech motor sequencing, but it functions in conjunction with the premotor and parietal cortex. Wernicke's area in the posterior superior temporal gyrus is for phonology and lexicon. Damage leads to different aphasias. Broca-type speech is sparse and wooden, while Wernicke-type speech is fluent but semantically empty. The right hemisphere contributes prosody and humorous subtexts. In bilinguals, the same nodes switch under the control of the anterior cingulate and dorsolateral prefrontal cortex. Frequent practice compacts the white matter of the tract, speeding up exchange. Reading relies on the visual word form area in the left fusiform gyrus. It is not innate, but an area of the visual system rewired for letters. 15th fact. Vision begins in the retina, where rods capture dim light and cones distinguish wavelengths. The fovea, a central ket, has the highest density of cones, which is why we aim our gaze there with microsaccades. The blind spot, where nerve fibers exit the eye, is where the brain quietly fills in the missing information. The pathway then continues through the lateral geniculate nucleus of the thalamus to the primary visual cortex, V1, where neurons are tuned to the orientation and position of contours, forming a retinotopic map. From here, two main streams diverge. The ventral, what stream, temporo-occipital areas, recognizes objects and faces, while the dorsal, where-how stream, parieto-occipital, is responsible for space and action. Damage to V1 can result in blind spot, where a person is unaware of a stimulus but can guess its direction, relying on subcortical pathways. Illusions distort perception not due to eye errors, but because the system actively predicts the world and sometimes makes a bet before the data arrives. 16th fact. Hearing begins in the cochlea, a spiral-shaped organ. Within it, a traveling wave on the basilar membrane sorts complex sounds by frequency. High frequencies resonate at the base and low frequencies at the apex. Mechanical displacement of the hair cell's stereocilia opens ion channels, converting vibration into an electrical signal for the auditory nerve. Already in the brainstem, specifically the superior olivary complex, binaural magic appears. Microsecond differences in timing and level between the ears allow for the calculation of the source's direction. Information then proceeds to the inferior colliculi, then through the medial geniculate body of the thalamus to the primary auditory cortex, where a tonotopic map is preserved. Damage to the outer hair cells makes sound dirty. Chronic noise exposure causes network retraining and tinnitus, a phantom ringing. A cochlear implant bypasses hair cells, delivering coded current directly to the auditory nerve via electrodes. It doesn't restore natural timbre, but provides intelligible speech and the ability to hear the world anew. Fact 17. Olfaction is one of the few sensitive inputs that go directly to the cortex, bypassing the thalamus. The axons of receptor neurons, residing in the nasal epithelium and regularly renewing themselves, extend to the olfactory bulb and then to the amygdala, hippocampus, and orbital frontal cortex. This explains why smells can instantly bring up memory frames. Each receptor recognizes an entire family of molecules, and the brain compiles a scent code based on the pattern of active glomeruli. Taste is structured differently. The basic qualities, sweet, salty, sour, bitter, and umami, are encoded by receptors on the tongue and palate, and signals travel via the facial, glossopharyngeal, and vagus nerves to the brainstem and then to the thalamus and insular cortex. Much of what we call the taste of a dish is actually retronasal olfaction, the flow of aromas from the mouth to the cribriform plate. During a cold, taste fades due to the loss of olfactory input. Anosmia alters eating behavior and safety by depriving us of early warnings about smoke, gas, and spoiled food. Fact 18. The basal ganglia are a system of loops: frontal cortex, striatum, pallidum/subthalamic nucleus, thalamus, frontal cortex, which fine-tunes action selection and their energy expenditure. Within them, a balance plays out between the direct pathway via D1 receptors, the gas, and the indirect pathway via D2 receptors, the brake. The former facilitates the initiation of useful programs, while the latter suppresses competitors and noise. Prediction errors in reward transmitted by dopamine adjust synapses, turning yesterday's attempts into tomorrow's habits. Imbalances in these pathways manifest differently. In Parkinson's disease, the gas weakens, leading to impoverished and slowed movements. In Huntington's disease, conversely, part of the inhibitory branch is destroyed, resulting in hyperkinesias. Deep brain stimulation in the subthalamic nucleus or the internal segment of the globus pallidus can alleviate pathological rhythms and restore motor control. The same principles apply to cognitive selection. We filter options, conserving effort, and the cost of an action is built directly into these loops. Fact 19. Attention is not a spotlight in one hand, but an entire brigade with roles. The orienting network, superior colliculi parietal cortex, quickly shifts gaze and priorities. The executive network, anterior cingulate and dorsolateral prefrontal cortex, suppresses distractions and maintains the goal. And the thalamus, particularly the pulvinar, synchronizes exchanges between visual areas. The phenomena of inattentional blindness and change blindness show that without allocating resources, the brain may not notice even a major change in a scene. Multitasking is more often a series of alternations. Each switch costs tens to hundreds of milliseconds and increases errors. The default mode network, medial prefrontal cortex, posterior cingulate, and angular gyrus, is active during mind-wandering and self-reflection. For a task, it must yield to the frontoparietal network. Attention training, sleep, monotasking, time boxing, and proper breaks enhances resilience, but biology does not promise endless focus. Fact 20. Emotions are distributed along a circuit. The amygdala quickly assesses stimulus significance and learns fear. The insula gives the experience bodily density. The hypothalamus initiates vegetative and endocrine responses. And the orbitofrontal and medial prefrontal cortex weigh consequences and take over regulation. Stress is a short-term helper and a dangerous neighbor. The hypothalamus releases CRH, the pituitary gland releases ACTH, and the adrenal glands release cortisol. In acute mode, this mobilizes energy and attention, but chronically undermines sleep, immunity, and hippocampal plasticity, impairing contextual memory. Emotion does not equal behavior. We can feel fear but move forward through top-down control. Social signals, gaze, intonation, facial expressions are read by the social brain network, including the temporal sulci and medial prefrontal cortex. Neuropeptides like oxytocin influence trust and attachment, but their action is context-dependent and does not turn people nicer at the push of a button. Fact 21st. The systems for wakefulness and attention are fueled not by a single fuel, but by an orchestra of modulators. The locus coeruleus in the brainstem releases norepinephrine, raising the cortex's gain. Neurons become more sensitive to important signals and suppress noise. The basal forebrain sends acetylcholine, which loosens cortical rhythms, facilitates synapse rearrangement, and maintains focus. During sleep, its level is high in REM sleep and low in deep slow-wave sleep. Norepinephrine and acetylcholine have different roles. The former is better for detecting novelty and reacting now, while the latter is for fine-tuning plasticity and attention to detail. The pulse of the locus coeruleus is tracked indirectly by pupil dilation. There is a stable correlation. In the clinic, this is seen in the effects of medications. Anticholinergic drugs blur memory and attention. Cholinesterase inhibitors sometimes improve speech and daily functions in dementia, and beta blockers smooth out emotional outbursts, weakening the consolidation of emotional episodes. Fact 22nd. Glia, the quiet half of the brain, works no less actively. Astrocytes embrace synapses with their end feet, regulate ion and mediator concentrations, and form a tripartite synapse with neurons, where their calcium waves modulate transmission. Glycogen is stored in their processes, an emergency energy reserve from which lactate is born. Via the astrocyte neuron shuttle, it fuels working networks when the pace is high. Oligodendrocytes myelinate multiple axons at once, speeding up potential jumps across the nodes of Ranvier. The thickness and length of myelin are plastic and change with experience, improving timing coordination between areas. Microglia, the immune patrols, mark weak synapses for dismantling and clean up the consequences of microinjuries. During chronic inflammation, their sentinel mode can become a source of excess noise. After injury, astrocytes form a glial scar. It simultaneously isolates the lesion, saving tissue, and hinders regeneration, a dual defense of the living city. Fact 23rd. One influential concept describes the brain as a prediction machine. It continuously builds hypotheses about the world and compares them with incoming data, minimizing error. Higher brain areas form expectations while lower ones check sensory input against a draft. When reality doesn't match, a mismatch signal arises, known in EEG as mismatch negativity. This explains the agility of speech perception in noise and the persistence of illusions. The system prefers a stable hypothesis over a brief anomaly. The weight of data versus expectations, or its accuracy, is adjusted by modulators like norepinephrine, acetylcholine, and dopamine in several models, linking it to attention and learning. An imbalance leads to clinical pictures. If priors are overemphasized, the world is adjusted to fit beliefs, potentially causing hallucinations. If data is overloaded with accuracy, every rustle becomes a surprise. This is not dogma, but a framework that remarkably integrates brain behavior, rhythms, and errors. Fact 24th. Modern neuroimaging techniques do not show thoughts on screen, but rather indirect traces of their activity. fMR registers the bold signal, changes in blood oxygen saturation, thus offering high spatial but limited temporal accuracy, as the response is delayed by seconds. DTI assesses how water prefers to diffuse along fibers, enabling the reconstruction of white matter tracts. PET, by introducing a radio-labeled marker, visualizes glucose metabolism or the distribution of proteins like amyloid and tau. Electro- and magnetoencephalography capture millisecond dynamics of fields, while optical spectroscopy allows observation of the cortex in infants and during movement. Causality, however, requires intervention. TMS knocks out a node and shows how the network changes its behavior without it. The reverse inference error, attributing a specific thought to an area based on its activation, is a common pitfall. Large sample sizes, pre-registration, and replications enhance reliability. Fact 25th. Stroke, an acute disruption of blood flow in the brain, can be ischemic, when a vessel is blocked by a clot, or hemorrhagic, when it ruptures and blood saturates the tissue. In the first case, time is critical. According to clinical protocols, thrombolytics are effective within a narrow window of hours from the onset of symptoms, and mechanical clot removal in selected patients helps even later. The faster, the greater the chances of saving the penumbra around the lesion. Signs are remembered by facial asymmetry, arm weakness, speech impairment, and sudden unsteadiness. In their presence, immediate emergency call is required. After the acute period, a long work of plasticity begins. Surrounding areas take over lost functions, aided by induced constraint of the healthy limb, intensive speech and motor therapy, and sleep normalization. Spasticity, depression, and fatigue are frequent companions, and comprehensive rehabilitation reduces them at the cost of time and systematic support. The brain is not a miracle worker, but it is stubborn and capable of finding detours. Fact 26th. The brain's internal clock is located in the suprachiasmatic nuclei of the hypothalamus, which are tiny clusters of neurons situated above the crossing of the optic nerves. They receive direct input from the retina via specialized ganglion cells sensitive to the blue spectrum and containing the pigment melanopsin. For this reason, morning light can adjust the circadian rhythm more accurately than any alarm clock. These nuclei set the pace for the hormonal axis. At night, the pineal gland increases melatonin production, body temperature drops, and tissues enter a repair mode. By dawn, cortisol levels rise, promoting wakefulness. Disruptions in timing, such as shift work or travel across time zones, desynchronize the pendulums of the liver, gut, and immune system. Consequently, a person may be awake, but their metabolism is still asleep. This leads to poorer glucose absorption, mood swings, and impaired attention. Regular light exposure, consistent meal times, and a stable sleep schedule are the three main levers for resetting these rhythms. Even a short morning walk helps shift the phases, while bright screens late in the evening do the opposite. Fact 27th. When a cortical area becomes active, blood flow changes accordingly. This is neurovascular coupling. Neurons, interneurons, and astrocytes form a neurovascular unit. Glutamate raises calcium in astrocyte processes, and these, via nitric oxide, prostaglandins, and other vasodilating agents, slightly open arterioles. More blood means more oxygen and glucose. The bold signal in fMRI is built on this. It reflects not the spikes themselves, but the balance between oxygen consumption and supply. The autonomic system adds another layer. Cerebral autoregulation keeps perfusion almost constant despite blood pressure fluctuations. And CO2 levels finely tune vessel diameter. Take a deeper breath, and cortical vessels will narrow. With age and vascular risks, the neuron-vessel connection becomes sluggish, affecting attention and processing speed. Migraine with aura shows the reverse. A wave of cortical depression triggers a characteristic cascade of vascular changes. Fact 28th. Intelligence is not located in a single center and is not determined by head size. The correlation between overall brain volume and cognitive test results is small and varies across samples. Network architecture and its efficiency are more indicative. So-called small world and rich club nodes with special connections in the frontoparietal areas are more common in people with high thinking flexibility and working memory. Cortical thickness and surface area are differently related to functions. In some places, synapse density is important, in others, the extent of maps. Myelination of tracts speeds up exchange between nodes. Skill training and education significantly alter white matter. Cognitive reserve, the sum of habits, education, bilingualism, social activity, helps to preserve functions longer with the same degree of age-related changes. It is not armor, but a reserve of detours. The neuromyth of big brain, big genius simplifies a much more subtle combination of genetics, environment, and experience. 29th fact. Experiments on readiness to move revealed a paradox in the timing of will. Fractions of a second before a person becomes aware of deciding to move a finger, a slow rise in activity, known as the readiness potential, already occurs in the motor areas. Modern studies of patterns in the frontoparietal cortex can predict a choice slightly earlier than the subjective now. This has sparked heated debates. Does the brain abolish free will? Strictly speaking, no. The data describe the statistics of simple, intentionally meaningless decisions and do not exclude the role of a veto, where prefrontal areas block an initiated impulse. Conscious will, in this picture, is not a start button but a quality control system, assessing context, social rules, and consequences. The more complex the task and the longer the planning horizon, the greater the contribution of networks responsible for goals and stop signals. Neuroscience has not reduced choice to a reflex, but has shown how early and distributed the prerequisites for our "I decided" can be. Fact 30. The gut-brain connection is not a metaphor, but a network of real channels. The vagus nerve transmits information about distension and chemical composition to the brainstem, while the microbiota releases short-chain fatty acids, vitamins, and tryptophan metabolites that can alter immune responses and gut barrier permeability. A significant portion of serotonin is synthesized in the enterochromaffin cells of the gut, but it barely crosses the blood-brain barrier. Its influence on the brain occurs through indirect pathways, immune signals, the vagus nerve, and hormonal cascades. Animal studies have shown that microbiota transplantation altered anxiety and behavior. In humans, there is emerging data on a modest reduction in subjective stress with certain probiotics, although the effects are individual and moderate. A fiber-rich diet supports microbial diversity, which is indirectly linked to mood stability. Conversely, chronic gut inflammation correlates with fatigue and brain fog. Two brains live side by side, constantly communicating. Fact 31. General anesthesia is not an off switch, but a subtle disruption of network coherence. Propofol and many inhaled anesthetics enhance GABAergic inhibition and alter cortical rhythms. On EEG, this manifests as prominent alpha activity around frontal leads and slow waves. At deep doses, burst suppression occurs, characterized by brief bursts of activity alternating with silence. Ketamine acts differently, blocking NMDA receptors and inducing a dissociative state with preserved reflexes and an unusual pattern of rhythms. The common denominator is the disruption of thalamocortical and frontoparietal loops, which normally integrate information into a unified experience. Local anesthetics like lidocaine block voltage-dependent sodium channels peripherally and do not affect consciousness, serving as an example of targeted intervention. Intraoperative awareness, when protocols are followed, is extremely rare. Controlled emergence is assessed by clinical science, EEG indicators, and precise drug dosing. 30-second fact. Hunger and satiety are a dialogue between the hypothalamus, the gut, and the reward system. In the arcuate nucleus, hungry AGRP/NPY neurons and satiated POMC/CART neurons coexist. Leptin and insulin suppress the former and activate the latter, while ghrelin from the stomach awakens appetite. These signals, through the paraventricular, lateral zones, and the vagus nerve, reorganize metabolism and behavior. The orbitofrontal cortex and the nucleus accumbens color food with the motivation of wanting. Sweet, fatty, ultra-processed foods combine quick calories and sensory hooks, enhancing dopamine surges and pushing towards overeating in conditions of abundance. Stress, via cortisol, shifts priorities towards fast carbohydrates. Chronic sleep deprivation increases ghrelin and decreases leptin, thereby breaking self-control. Bariatric surgery in some patients reduces cravings not only through mechanics but also hormonally, altering GLP-1 and other gut peptides. Meal timing and morning light synchronize rhythms, helping to maintain balance. 33rd fact. Mirror neurons, which are cells that activate both when performing an action and when observing it, were first described in the premotor cortex of macaques, area F5. In humans, the mirror system is considered a distributed network in the inferior frontal and inferior parietal cortex, supporting imitation, observational learning, and gesture recognition. The suppression of the mu rhythm over the motor cortex on EEG when seeing movements is one indirect marker of this resonant work. However, there has been much exaggeration surrounding it. Ideas that mirror neurons fully explain empathy or language have not been confirmed, as emotions and speech rely on broader circuits involving limbic and frontotemporal nodes. The practical implications, however, are clear. Demonstrating movements speeds up the acquisition of motor skills, and mirror therapy helps the brain retrain the body map for phantom limb pain, while the patient observes an illusory healthy hand in the mirror and matches the visual with a motor command. Fact 34th. Synesthesia is a stable cross-modal perception, where, for instance, numbers and letters have their own colors, and sounds evoke visual forms. It is estimated that between a fraction of a percent and a few percent of people possess it. Furthermore, the association maps are stable for years and pass objective consistency tests. A synesthete will more quickly name the correct color for their letter and more slowly for an incorrect one. Neuroimaging indicates enhanced connections between the area for the visual form of a word and color-sensitive zones in the fusiform gyrus. There are theories about unfiltered pathways that are filtered in most people. Synesthesia can also arise after injuries or under the influence of psychedelics, but such cases are rare and variable. In everyday life, it does not make a person a genius, but it provides unusual memory hooks. A phone can turn into a drawing and a date into a palette. It is important to distinguish it from metaphors. A warm sound is a figure of speech, not a neural interweaving of channels. 35th fact: brain aging is not a collapse but a slow change of parameters. With age, processing speed, subtle aspects of working memory, and switching flexibility decrease, while vocabulary and accumulated knowledge hold up better. At the microstructural level, synapse density reduces, myelin changes, and cerebral perfusion worsens, leading to noise and fatigue. A normal variant differs from neurodegeneration. In Alzheimer's disease, episodic memory and orientation are affected early. Amyloid and tau pathology accumulate, and default mode networks are disrupted. Age is the main risk factor, but trajectory is influenced by vascular health, sleep, movement, hearing aids for hearing loss, socialization, and cognitive task diversity. These form a reserve that allows for longer compensation of damage. Prevention does not guarantee protection, but it shifts the onset of symptoms and eases daily life. Early diagnosis of mild cognitive impairment offers a chance to restructure lifestyle and support in time. Fact 36th. The brain's navigation is built on specialized map cells. In the hippocampus, place cells operate. Each one lights up when an animal or person is in a specific spot. In the entorhinal cortex, grid cells with a remarkable hexagonal pattern of fields are found. They encode the distance traveled and direction, maintaining internal odometry, path integration. There are also head direction cells, indicating a compass, boundary cells, reacting to walls and cliffs, and speed neurons. Under the theta rhythm, sequences are recorded, a series of flashes reflecting the route. During sleep and rest, the hippocampus replays traversed trajectories, which is linked to the consolidation of spatial memory. In humans, similar patterns are found via MEG/EEG and intracranial recordings. Changes in these networks appear early in neurodegeneration, leading to impaired orientation and the loss of map anchors. The geometry of a space can distort the grid step, showing that this system is sensitive to the world's shape, not just steps and turns. Fact 37th. Epilepsy is a brain's tendency towards paroxysmal hypersynchronization. In focal seizures, the discharge starts in one zone, say the temporal lobe, causing unusual smells, déjà vu, and gaze arrest with automaticisms. Generalized tonic-clonic seizures involve falling, body stiffening, and rhythmic convulsions. Absences, which are brief lapses of consciousness in children, are accompanied on EEG by classic 3 Hz spike wave complexes. Triggers are diverse: sleep deprivation, abrupt alcohol withdrawal, and flickering light in photosensitive patients. A seizure lasting over 5 minutes is a threat of status epilepticus and an emergency. Treatment relies on anticonvulsants, from sodium channel blockers to levetiracetam targeting SV2A and valproate enhancing GABA. For drug-resistant cases, focal resection, vagus nerve stimulation, or adaptive neurostimulation help, while a ketogenic diet sharply reduces seizure frequency in some children. Safety and SUD prevention are important, adhering to therapy and monitoring nocturnal seizures. Fact 38th. Autism spectrum disorders are a diverse group of developmental differences. Core features include challenges in social communication and flexible behavior, along with unusual sensory sensitivity, ranging from overreactions to sounds to seeking intense stimuli. Neurobiologically, they are described by shifts in the excitation-inhibition balance, peculiarities in synaptic plasticity, and connectivity patterns. Local networks may be denser, while long-range ones are weaker, affecting signal integration. Genetics are polygenic, spanning common variants to rare syndromes, e.g., disruptions in synaptic protein genes. Environmental factors modify the trajectory, but do not create ASDs from scratch. Early support, teaching communication, alternative communication methods, structuring the environment, enhances autonomy. Successes depend on individual profiles, not a universal protocol. It's important to avoid stigma. Alongside difficulties, many possess strengths like systemic thinking, attention to detail, and sustained interests. 39th fact. Multiple sclerosis is an autoimmune disease of the central nervous system. In this condition, immune cells attack myelin, which is produced by oligodendrocytes. This leads to slowed nerve signal conduction and axon damage. The common relapsing-remitting type is characterized by periods of exacerbations followed by partial or complete recovery. There are also primary progressive and secondary progressive forms. Symptoms can be quite varied: optic neuritis, causing pain with eye movement and blurred vision, fog, numbness, unsteadiness, spasticity, fatigue, Lermit's sign, an electric shock sensation when bending the neck, and worsening in heat. Uthhoff's phenomenon. Diagnosis relies on MRI, which shows lesions in typical areas, periventricularly in the corpus callosum, and cerebrospinal fluid analysis for oligoconal IgG. Exacerbations are treated with glucocorticosteroids. Disease course is modified by interferons, gladarammer, drugs targeting the sphingosine-1-phosphate pathway, and monoclonal antibodies, e.g. anti-CD20, considering risks like progressive multifocal leukoencephalopathy, PML, with natalizumab. Rehabilitation, vitamin D intake, smoking cessation, and fatigue management help maintain function, while remyelination research seeks ways to restore axon insulation. Fact 41. The feeling of "I am this body" is formed from interoception, proprioception, and tactile and vestibular signals. The insular cortex encodes internal states, heart rate, breathing, gut tension, and their subjective salience. The somatosensory cortex provides a surface map. The cerebellum and parietal cortex integrate limb position, and the vestibular system reports turns and accelerations. The rubber hand illusion demonstrates how vision and synchronous touches can rewrite ownership. The brain accepts the substitution if the signal statistics converge. Stimulation of temporoparietal junctions can lead to out-of-body experiences, a breakdown in the alignment of perspective and body map. Interoceptive accuracy is linked to emotions. People who better sense their heartbeat experience anxiety more acutely, but also use breathing more effectively for self-regulation. Slow diaphragmatic breathing, mindfulness training, and biofeedback increase heart rate variability, a marker of autonomic nervous system flexibility and stress resilience. Fact 41. Rapid eye movement, REM sleep, is a paradoxical state where the cortex is electrically active, eyes move rapidly, and the body is immobilized. This atonia is caused by a network in the brainstem, including pontine neurons that suppress spinal cord motor neurons to prevent us from acting out our dreams. During this period, the amygdala and occipital regions are active, while the oversight of the dorsolateral prefrontal cortex is reduced, leading to vivid imagery, illogical plots, and strong emotions. REM sleep is linked to affect processing. After an anxious day, dreams often re-edit memories, reducing emotional charge without losing facts. PGO waves, pons geniculate occipital, are also observed, accompanying visual flashes during dreams. REM sleep deprivation impairs mood and learning on complex tasks. Lucid dreaming is a rare state where the frontoparietal network is engaged and the person realizes they are dreaming. Training techniques exist, but their effectiveness is modest and their role for the psyche remains a subject of research. Fact 42. Attention deficit hyperactivity disorder is not a behavioral problem, but a neurodevelopmental difference linked to the functioning of frontostriatal networks and the modulation of dopamine and norepinephrine. Behaviorally, it manifests as difficulties in goal maintenance, increased distractibility, impulsivity, and sometimes motor restlessness. In decision-making, there's a tendency towards delay discounting, where immediate rewards are subjectively valued more than future ones. First-line medications are psychostimulants like methylphenidate and amphetamine, which increase dopamine and norepinephrine availability in prefrontal circuits, improving signal-to-noise ratio. Non-booster alternatives include atomoxetine, an NET inhibitor, and guanafine, an alpha-2A agonist. The best outcomes are achieved through a combination of medication with behavioral support, environmental structuring, and planning skills training. Myths about a sugar cause or that everyone outgrows it are not supported by evidence. While developmental trajectories vary, appropriate help significantly enhances quality of life and academic social outcomes. Fact 43. Music engages the brain like few other things. Rhythm synchronizes motor and auditory areas, basal ganglia and cerebellum build predictions of segments, and the dopamine system reacts to the anticipation and resolution of harmonic tensions. This is why goosebumps occur at the climax. Emotion is linked not only to melody, but also to the precise timing of surprises. Rhythmic audio stimulation helps with Parkinson's disease. Steps become longer and steadier because an external marker picks up the internal metronome. For aphasia, melodic intonation therapy is used. Singing and rhythm bypass damaged speech pathways, strengthening the connection between temporal and frontal lobes. Prolonged musical training changes cortical maps and the white matter of tracts, accelerating interhemispheric exchange. Some people have absolute pitch, the ability to name notes without reference, but this is rare and requires early practice. Even passive listening helps regulate emotions and reduce physiological stress, if the tempo and volume are chosen without overload. Fact 44. Brain-computer interfaces translate neural activity into commands. Non-invasive EEG systems read cortical oscillations, allowing users to select letters or a cursor, but they suffer from noise and low bandwidth. Invasive microelectrode arrays, e.g. Utah array, and electrocorticography provide cleaner signals. By decoding patterns in the motor cortex, they can interpret intentions to move a cursor, grasp objects, or mentally write by imagination. Speech neuroprosthetics already convert cortical activity into synthesized speech or text for people with anarthria. This restores communication for individuals with locked-in syndrome and severe brainstem damage. However, alongside these capabilities, neuroethical questions arise. Who owns the raw brain data? How to protect privacy? And how to avoid imposed stimulations and inflated expectations? Surgical risks and implant longevity also limit their application. A realistic direction is assistive technologies and rehabilitation, where the person remains in control of the loop. Fact 45. Effective learning is less like funneling information and more like the brain's engineering cycle. Spaced repetitions allow the hippocampus and cortex to solidify traces through a nightly replay. Interleaving tasks trains feature recognition and flexibility, not just the muscle memory of a single pattern. The key driver is retrieval. The attempt to recall, even with errors, strengthens the trace more than passive rereading because it activates the same indexing networks and triggers a beneficial dopamine surprise. The illusion of fluency is deceptive. What reads smoothly may not transfer to action. Small, desirable difficulties, varied conditions, ungraded tests, explaining in one's own words create more robust, context-independent representations. Movement and aerobic exercise increase BDNF levels and improve blood flow, aiding plasticity. Sleep completes the cycle, stabilizing necessary connections and pruning excess ones. Fact 46. Psychedelics are not magic keys, but pharmacological tools that sharply alter information processing modes in the brain. Their common target is the 5-HT2A serotonin receptors, particularly on pyramidal neurons in layer V of the cortex. Their activation increases excitability, enhances rhythm desynchronization, and raises activity entropy. At the network level, a temporary unraveling of the default mode network and unusual bridges between distant areas are often observed. This means the brain relies less on habitual patterns and more actively tries out combinations. This is linked to a brief window of heightened learning capacity and the reprocessing of rigid thought patterns, which is being explored in therapies for depression, end-of-life anxiety, and post-traumatic stress. However, the effect is context-dependent. The environment, expectations, and support are critical. Risks ranging from anxious reactions to the exacerbation of psychosis in vulnerable individuals necessitate strict protocols and medical supervision. This is about controlled intervention in network operation, not a miracle. Fact 47. Dyslexia is a persistent difficulty in learning to read despite normal intelligence and schooling. It is most often linked to phonological processing issues, meaning the breakdown of words into sound units. Neuroimaging studies indicate less efficient functioning in the left temporal parietal and frontal nodes, as well as the visual word form area in the left fusiform gyrus. A deficit in rapid naming and the automation of the letter-sound correspondence is characteristic. Genes contribute significantly, but language also matters. Deep orthographies with inconsistent correspondences, like English, exacerbate manifestations, while transparent ones, like Finnish, mitigate them. Structured phonetic programs and multisensory practice, started as early as possible, are helpful. Methods like colored rulers and eye training exercises have little evidence because the problem is not with visual acuity. Adults with dyslexia often compensate with strategies, and their strengths may lie in visual spatial tasks and inventiveness, highlighting the diversity of profiles. Fact 48. Migraine is not merely a severe headache, but a neurovascular syndrome. In migraine with aura, cortical spreading depression is triggered, a slow wave of suppressed activity followed by changes in blood flow and sensitivity. Nerve fibers of the trigeminal system release neuropeptides, primarily CGRP, widening blood vessels and intensifying the inflammatory signal. This results in throbbing pain, nausea, photophobia, and worsening with exertion. Triggers are individual: lack of sleep, skipped meals, bright flickering light, hormonal fluctuations. For some women, attacks become more frequent due to falling estrogen levels. Acute treatment uses triptans, 5-HT1B/1D agonists, new DTANs, 5-HT1F, and GPANs, CGRP antagonists. For prevention, beta blockers, topiramate, botulinum toxin for chronic cases, and monoclonal antibodies against CGRP/its receptor are used. Sleep patterns, hydration, and regular meals are simple yet significant levers for reducing frequency. Fact 49. A concussion is a functional disorder following a blow or sudden acceleration rotation of the head, characterized at the micro level by an ionic storm. Glutamate release, potassium efflux, ATP depletion by pumps, and a brief metabolic crisis amidst relative hypoperfusion. This leads to typical symptoms such as headache, brain fog, photophobia and phonophobia, sluggishness, and sometimes short-term amnesia without mandatory loss of consciousness. Red flags, worsening condition, repeated vomiting, unequal pupils, limb weakness necessitate urgent evaluation for intracranial hematoma. The modern approach involves brief relative rest for 24 to 48 hours, followed by a gradual return to cognitive and physical activity under symptom monitoring. Prolonged, complete isolation can delay recovery. Repeated blows without full recovery are dangerous due to the second impact syndrome. Helmets protect against fractures and lacerations, but do not entirely eliminate rotational accelerations. Thus, prevention, technique, and rules is as important as equipment. The 50th fact states, creativity is not about the right hemisphere, but rather the coordination of three networks. These include the default mode network, medial prefrontal cortex, posterior cingulate for free associations, the executive network, dorsolateral prefrontal cortex, parietal regions for selection and refinement, and the salience network, anterior cingulate, insula for switching between them. Research indicates that insights are often preceded by alpha changes over the occipital lobe, temporary shutting off of distracting inputs, and short gamma bursts when a solution clicks. Incubation, which involves shifting attention to another task or going for a walk, allows the networks time to explore options without rigid control. Novelty in the environment and mild constraints broaden the search. However, a wild flow without filtering is not productive. The best ideas emerge from rapid adjustment between generation and criticism. Long practice in a domain strengthens relevant pathways, and REM sleep helps to reconfigure connections between distant concepts, hence the frequent aha moments in the morning after a roadblock the day before. Fact 51. Acetylcholine is the subtle conductor of attention and memory. Cholinergic neurons of the basal forebrain, including the nucleus of Maynard, project fan-like into the cortex and hippocampus, enhancing plasticity on demand. This signal facilitates synaptic restructuring, deepens the figure-ground contrast, and aids in shifting focus to new stimuli. Muscarinic receptors, e.g. M1, alter the excitability of cortical microcircuits, while nicotinic receptors act faster and are involved in sensory filtering. Consequently, nicotine can temporarily improve attention stability, though this comes at the cost of tolerance and dependence. During sleep, acetylcholine levels are low in slow-wave phases and high in REM sleep, which is linked to the re-editing of memory traces. Anticholinergics blur memory and can cause delirium, especially in the elderly. Conversely, cholinesterase inhibitors partially support speech and daily functions in dementia. The system does not operate in isolation, but without it, the cortex struggles to learn and to separate important information from noise. Fact 52. Movement begins not in the muscle but in a distributed network. The supplementary motor area sets the sequence pattern. Premotor areas encode goals into spatial coordinates. The primary motor cortex transforms these into impulses via the pyramidal tract. Corticospinal tract axons cross in the medulla so the left hemisphere controls the right side of the body. Motor cortex neurons are tuned to directions and forces. The collective population vector predicts trajectory. Damage to the upper motor neuron causes spasticity, hyperreflexia, and Babinski sign, whereas peripheral damage results in flaccid paralysis and atrophy. Spinal central pattern generators allow walking even with limited cortical input, and training shapes cortical maps. For violinists, the finger hand occupies more screen space. TMS over the motor cortex elicits brief twitches, direct confirmation of map specificity. The brain learns to move throughout life. from first clumsy attempts to a professional's masterful economy. Fact 53. The corpus callosum is the largest bridge between the hemispheres, comprising hundreds of millions of fibers that synchronize vision, language, and planning. When it is surgically severed for resistant epilepsy, the world does not fall apart, but remarkable two-operator effects emerge. Information that enters the left visual field, and thus the right hemisphere, can be recognized non-verbally through gesture or drawing, while verbal reporting is difficult, as speech is typically written in the left hemisphere for most people. The left hemisphere often acts as an interpreter, inventing plausible explanations for actions of the right hand, initiated by the right hemisphere. Less commonly, alien hand syndrome occurs, where a limb makes independent, conflicting movements, a consequence of the disconnection of fronto-premotor pathways. Normally, the corpus callosum not only connects but also disconnects, suppressing mirror symmetries for independent movements. Its thickness and microstructure change with the practice of bimanual skills, speeding up interhemispheric transfer. Fact 54. Theory of mind: the ability to attribute beliefs and intentions to others relies on a network that includes the temporoparietal junction, posterior superior temporal sulcus, medial prefrontal cortex, and posterior cingulate cortex. The classic false belief test demonstrates its function. A child learns to understand that another person can be mistaken and predicts behavior based on the other's information, not their own. Neuroimaging shows these nodes activating when reading stories about motives and interpreting viewpoints. This network overlaps with the default mode network, unsurprisingly, as thinking about oneself and others is computationally similar. Impairments in modulating this system manifest differently. Individuals with autistic traits may struggle with spontaneously reading nonverbal cues, whereas psychopathy tends to affect the affective response to another's pain while preserving cold modeling. Mentalization is a skill trained by context, language, and social experience. Fact 55th. Consciousness is not a light bulb, but a property of network dynamics, and science lacks a unified answer on how exactly. The global workspace theory suggests that what becomes experienced is what ignites and spreads through the frontoparietal system, granting access to memory, speech, and planning. Its empirical markers include late EEG components and a sharp increase in connectivity. The integrated information theory emphasizes compressing causal relationships within a system and proposes a measure of integration, though it is difficult to measure outside a model. The recurrent processing theory highlights local feedback loops in the sensory cortex. Sufficient feedback leads to phenomenal experience without necessarily requiring frontal ignition. Experiments with backward masking, binocular rivalry, as well as anesthesia and deep sleep show that the balance of long-range connections, temporal coordination, and access to report are key. It will likely be necessary to combine several frameworks to describe the different facets of conscious experience. Fact 56. Face recognition is a distinct specialization of the visual system. Within the fusiform gyrus lies the fusiform face area, FFA, which is particularly sensitive to the overall configuration of eyes, nose, and mouth. Closer to the back of the head is the OFA, which handles more localized features. The superior temporal sulcus, STS, tracks dynamics, gaze, facial expressions, and mouth movements. This leads to vulnerabilities. Prosopagnosia deprives a person of the ability to recognize familiar faces, while vision for objects and landscapes remains intact. It can be congenital or acquired after damage. The opposite case is Capgras syndrome, where recognition occurs but the emotional familiarity response is cut off and loved ones appear as doppelgangers. The Thatcher illusion demonstrates that the system encodes configuration. An inverted, distorted face appears normal for a long time. Pareidolia, faces in outlets and clouds, is a side effect of hypersensitive detection of social cues, which was useful in evolution. Fact 57. Stuttering, a disruption of speech fluency marked by repetitions, prolongations, and blocks, is not due to a lazy tongue, but rather to neural circuits for timing and sensory motor coordination. Research indicates differences in white matter within the left arcuate cassiculus and specific functioning of the basal ganglia and supplementary motor area. The network responsible for sequencing syllables falters under load. Dopamine modulation is also involved. Dopamine antagonists reduce stuttering frequency in some patients, and altered auditory feedback, delay, pitch change, temporarily smooth speech by shifting control to other loops. Singing and choral speech are almost always easier, aided by rhythm and a preset pattern. The best results come from speech therapy programs, fluency shaping, stuttering modification, combined with work on anxiety and avoidance. The goal is not perfect diction, but confident communication and symptom control in real-life situations. Fact 58. Disorders of consciousness are distinguished along two axes: wakefulness and awareness. Coma is when neither is present. Eyes are closed, and there are no sleep-wake cycles. A vegetative state, or unresponsive wakefulness syndrome, means eyes open, cycles exist, but there are no signs of a meaningful response. A minimally conscious state involves rare but reproducible traces of intentional response, such as fixing gaze on command or making a yes-no gesture. Locked-in syndrome is a different category. Consciousness is preserved, but brainstem damage blocks movement, leaving only vertical eye movements. Diagnosis relies on scales like CRSR, EEG markers, P300, mismatch negativity, and sometimes on mental imagery in fMRI EEG, where the patient responds by imagining playing tennis or walking around the house. TMS EEG assesses the complexity of the network's response. Treatment is limited, but rare awakenings on zolpidem or thalamic stimulation have been described. Care, complication prevention, and ethical decisions by the family and team are important. Fact 59th. Time perception doesn't rely on a single chronometer. The brain measures duration using different systems. For millisecond intervals, the cerebellum and sensory motor loops are crucial. Seconds and tens of seconds are linked to the striatum and the rhythm of cortical oscillators, whose beats converge on the neurons of the striatum, one model being striatal beat frequency. Dopamine alters the speed of internal clocks. Stimulants subjectively speed up time, while antipsychotics and Parkinson's disease do the opposite, slowing it down and impairing interval reproduction. The insular cortex adds a bodily component to timekeeping. The more intense the interoceptive signals, the longer a moment feels. The chronostasis illusion, where a clock's hand appears frozen after a saccade, shows how the brain fills in visual gaps. According to the Finford law, we tend to overestimate short intervals and underestimate long ones. Attention and novelty stretch subjective duration, while routine compresses it, demonstrating that time is a calculation, not an emission. The 60th fact states that memories are not permanently sealed. When retrieved, they enter a labile state and require restabilization, known as reconsolidation. Animal experiments showed that blocking protein synthesis after reactivating a memory weakened it. In humans, the emotional component of fear can be softened by recalling it and conducting exposure during its window of vulnerability, or by administering the beta blocker propranolol, which doesn't erase the fact but reduces the autonomic response. This opens the way for more robust treatments for phobias and post-traumatic memories, where the goal is to update the memory's meaning, transforming threat into a safely experienced episode. However, results are variable. Not every trace is easily rewritten. The window is brief and context-dependent, and the method requires strict methodology to avoid harm. The ethical question of interfering with one's personal history of feelings remains open. The realistic conclusion is that memory is plastic and edited by experience, especially when we retrieve it. Fact 61. Thermoregulation and thirst are managed in the hypothalamus, acting like a control center. Within the preoptic area, temperature-sensitive neurons establish the body's temperature set point. When infections via prostaglandins PGE2 raise this set point, fever occurs. The skin becomes pale due to vasoconstriction and chills set in as the body tries to reach the new temperature level. Antipyretics inhibit prostaglandin synthesis, lowering the set point. Osmoreceptors in the organum vasculosum laminae terminalis and the subfornical organ detect increasing plasma concentration and trigger thirst. Concurrently, the supraoptic and paraventricular nuclei release vasopressin, which helps the kidneys retain water. A decrease in blood volume activates the renin-angiotensin system. Angiotensin II acts on circumventricular organs, enhancing the drive to drink and consume salt. The sympathetic system controls sweating in humans via cholinergic fibers, skin vasodilation, and changes in heat production. Behavioral responses like seeking shade, wearing clothes, and drinking are part of this same chain, where the cortex aids the body in anticipating overheating by utilizing prediction rather than solely relying on sensors. Fact 62. Hypothalamic pituitary axes translate thought and stress into the body's hormonal language. The classic HPA axis, CRH from the paraventricular nucleus, pituitary ACTH, adrenal cortisol. Its morning peak helps wake you up, while chronic excess impairs sleep, context memory, and immune balance. TRH, TSH, thyroxine regulates metabolism and heat production. GnRH pulses controlling LH, FSH, and sex hormones. The tapping frequency changes the response profile. Prolactin is inhibited by dopamine, and oxytocin and vasopressin are released from the posterior pituitary, affecting childbirth, lactation, water balance, and social bonds. Feedback loops are the main safeguard. Cortisol and thyroxine suppress their own taps. Limbic and prefrontal areas, sensing threat or a goal, shift set points. This is allostasis. The system maintains stability through change. The long-term cost is allostatic load, pressure, visceral fat, fatigue. Rhythms, light, diet, and stress management are levers that return the axes to an economical mode. Fact 63. The brain and the immune system engage in a constant dialogue, which is evident in the patient's behavior. Sleepiness, reduced appetite, body aches, and avoidance are not signs of weakness, but rather adaptive recalibrations. Cytokines IL-1 beta, IL-6, and TNF-alpha act on bypass zones of the barrier and on the vagus nerve, altering the activity of the hypothalamus and monoamine systems. Microglia in the brain switch to a sentinel mode, enhancing clearance and changing synaptic plasticity. Fever is merely the tip of the iceberg. Deeper changes involve shifts in motivation and reward sensitivity. In obesity and chronic stress, mild systemic inflammation correlates with fatigue and brain fog. Tryptophan is rerouted to the kynurenine pathway, reducing its availability for serotonin synthesis and producing metabolites that affect NMDA receptors, one mechanism of inflammatory anhedonia. The receding wave of inflammation must subside in time. If immune cells breach a damaged barrier, the risk of neurotoxicity increases. Balancing sleep, movement, nutrition, and treating inflammatory foci restores the dialogue to normal. Fact 64. Antidepressants do not work as a joy pill, but through a slow recalibration of neural networks. Selective serotonin and norepinephrine reuptake inhibitors rapidly alter mediator levels in synapses, but the clinical effect is delayed. This is because the hippocampus and prefrontal loops need to increase plasticity, shift BDNF signals, and adjust connection architecture. Ketamine provides a rapid improvement within hours by blocking NMDA receptors on interneurons, causing a glutamate surge and AMPA potentiation, which initiates synaptogenesis cascades. The window of enhanced learning it opens offers a chance to consolidate new behavioral patterns. Electroconvulsive therapy remains effective for treatment resistance, likely through a profound network reset. RTMS over the left dorsolateral prefrontal cortex alters corticostriatal thalamic dynamics. Psychotherapy reorganizes the same networks from top down, through meanings and skills, and, in conjunction with pharmacotherapy, yields a more stable outcome. Individualized selection, consideration of side effects, and proper discontinuation to avoid withdrawal syndrome are important. Fact 65th. High sports accuracy is a prediction neurocomputer. The cerebellum builds internal models, pre-calculating the sensory consequences of movements and minimizing error. The basal ganglia reinforce successful patterns, and the motor cortex refines impulses to save micronewtons. The quiet eye phenomenon, a long final gaze fixation before a throw or strike, correlates with reliability because it stabilizes sensory motor alignment and filters noise. Mental rehearsals activate motor networks and improve actual performance, especially if the imagery is detailed in tactile and kinesthetic sensations. Peripheral vision and anticipation move reaction time below pure time. Experience allows starting based on subtle cues. Sleep closes the learning cycle, and moderate aerobic exercise increases BDNF, speeding up skill integration. Caffeine improves alertness and simple reaction speed, but fine motor skills and timing suffer with excess. Each training session works not only on muscles, but also on repeatedly rewiring white matter tracts and synapses. Fact 66th. Decision-making is not a single yes-no button, but a negotiation between networks for evaluation, uncertainty, and control. The orbitofrontal cortex encodes the current price of options, considering context and potential outcomes. The anterior cingulate cortex tracks conflict, error, and effort costs, prompting strategy changes. Dopamine carries the reward prediction error signal and adjusts value. Serotonin, according to several data points, is more involved in patience, punishment, and impulse refusal. Norepinephrine from the locus coeruleus increases readiness to explore the new with heightened uncertainty, observable in pupil dilation. We balance between exploration and exploitation, choosing the proven or taking a risk. The framing effect causes the same chance to be evaluated differently if presented as a loss or a gain. In the Iowa gambling task, patients with frontal lobe damage reach for immediate gain, ignoring the future. Choice is a calculation under noise, where emotions set priorities and control maintains the course. Fact 67th. Our brain pieces together reality from different modalities, and this cohesiveness follows statistics. If a sound arrives slightly earlier and from the correct side, it pulls the image towards itself, the ventriloquist effect. If two clicks are added to a single flash, many people see two flashes, an illusion born in the superior temporal sulcus. A classic example is the McGurk effect. Ba turns into da-ga when lips and sound conflict because the system trusts the most informative channel in a situation. The superior colliculi and parietal areas combine vision, hearing, and touch maps for orientation, and the weight of each channel dynamically changes based on how reliable it is right now. This explains the advantage of eye contact in a noisy bar and the power of a sudden, low, fierce sound that many species quickly turn to. Rhythms aid synchronization. A beat facilitates the coupling of the audible and visible. A miscalibration of weights leads to sensory distortions, while training improves integration, which is used in post-stroke rehabilitation and for auditory-visual integration disorders. Fact 68th. Bilingualism is the constant suppression of one code and the activation of another, serving as a training ground for control networks. The anterior cingulate cortex and the dorsolateral prefrontal cortex are involved in suppressing competing lexical activities, while the caudate nucleus aids in switching. Hence, moderate advantages for some bilinguals in tasks of interference and flexibility, though this effect is variable and depends on age of onset, intensity of use, and social conditions. Early bilinguals form phonological categories more plastically and hold accents more easily, while late bilinguals find it harder, though vocabulary and grammar catch up with practice. Language switching has a cost in milliseconds, but this cost decreases with prolonged experience. Several studies have linked multilingualism to a later onset of dementia at a group level, discussed as a contribution to cognitive reserve. But causality is not obvious, with education and lifestyle also influencing it. At the microstructural level, strengthening of the arcuate fasciculus and premotor connections is described, speeding up articulatory planning. The key is not a superpower gift, but long-term fitness for attention control and communication. Fact 69th. Tourette's syndrome is a neurodevelopmental condition characterized by motor and vocal tics, typically beginning in childhood and peaking in early adolescence. Tics are preceded by a premonitory bodily sensation, such as itching or tension, which is relieved by movement. Voluntary suppression of tics is possible for minutes but leads to increasing discomfort. The underlying mechanism involves peculiarities in thalamostriatocortical loops and dopamine modulation of habits. Stress and fatigue exacerbate the manifestations. Common comorbidities include ADHD and obsessive-compulsive symptoms. Coprolalia, characterized by profanity-laced outbursts, occurs in a minority and does not define the diagnosis. The first line of treatment is behavioral therapy, CBIT, habit reversal and trigger management, which teaches competing movements and reduces tic frequency. Medications are selected individually. Alpha-2 agonists like guanfacine, low-dose antipsychotics, or sometimes VMAT2 inhibitors. For severe resistance, deep brain stimulation of the globus pallidus or thalamus is discussed. The goal is functional freedom, not the sterile absence of movement. Fact 70. Spatial neglect syndrome is an instructive example that seeing and noticing are different things. After damage to the right temporoparietal network, a person may ignore the left half of the world, eating only from the right side of the plate, shaving halfway, or crossing out lines while leaving the left side of the page untouched. This is not blindness. With directed attention, they can recognize an object on the left, but without a prompt, they miss it. There is personal neglect, one's own body, and impersonal neglect, external space. The phenomenon of switching off when stimuli compete, and even neglect in imagination. In a classic experiment, patients described a room forgetting the left side regardless of their viewpoint. Since the right hemisphere dominates attention distribution, left-sided neglect is more frequent and severe. Rehabilitation uses prismatic adaptation, visual cues, scanning training, and vibro/caloric stimulation for a temporary bias of attention in the required direction. The dorsal/ventral attention networks teach us that the map of the world is a controlled spotlight, not a simple snapshot. Fact 71. Schizophrenia is not split personality, but a disorder of perception, thinking, and motivation integration. It most often begins in late adolescence and young adulthood. Some individuals experience predominantly delusions and auditory hallucinations, while others show negative symptoms like poverty of speech, reduced volition, social withdrawal, and cognitive difficulties such as impaired working memory and processing speed. Biologically, an imbalance in dopaminergic modulation in the striatum is discussed, where the salient signal is too easily triggered, along with glutamatergic impairments, particularly in cortical NMDA receptor-dependent pathways. Network studies revealed disruptions in the default mode and frontoparietal connections, worsening the filtering of internal and external signals. Antipsychotics block D2 receptors and reduce positive symptoms, but are less effective for negative and cognitive symptoms. Psychoeducation, family support, cognitive training, and social skills training are helpful. Trajectories vary. Early and consistent help improves long-term outcomes. Fact 72nd. Obsessive-compulsive disorder, OCD, involves intrusive thoughts, obsessions, and repetitive behaviors, compulsions. These rituals temporarily reduce anxiety but ultimately reinforce a cycle. In neural networks, hyperactivity is observed in the orbitofrontal cortex, anterior cingulate cortex, and caudate nucleus within the cortex striatum thalamus cortex loop. This is akin to a quality control system stuck in a checking mode. The themes of obsessions vary, including contamination, symmetry, doubts about causing harm, or moral purity. Crucially, critical thinking remains intact. The person knows their thoughts are excessive but cannot let them go. Effective therapy is exposure and response prevention, ERP. This method involves systematically confronting fears without performing rituals, teaching the brain that threats do not materialize. Pharmacologically, selective serotonin reuptake inhibitors, SSRIs, at high doses are helpful, and antipsychotics are added for resistance. In the most severe cases, deep brain stimulation of the internal capsule, globus pallidus, is considered. Emphasis on values and functionality is important. The goal is not to erase thoughts, but to restore freedom of action. 73rd fact. Post-traumatic stress disorder is a consequence not of the trauma itself, but of how the brain rewrote the world after it. The amygdala becomes hypersensitive to threats. The hippocampus struggles to anchor memories to the context of there and then, and the medial prefrontal cortex less effectively suppresses automatic fear. This causes triggers to teleport a person into the past, inducing flashbacks and nightmares. Sleep, particularly REM sleep, normally processes affect, but in PTSD it becomes fragmented. Hence the intrusive repetition of dreams and daytime hyperarousal. Treatment focuses on controlled relearning. Prolonged exposure and cognitive memory reprocessing help anchor the episode to the safe present. EMDR adds rhythmic attention stimulation as a supporting tool. Pharmacotherapy includes SSRIs, targeted work on sleep and pain. Interventions in reconsolidation, for example with beta blockers, are being explored, but this is not yet routine. Support from one's environment and gradual return to activity are as crucial as therapy sessions. Fact 74th. Addiction is not a weakness, but a reprogramming of reward learning systems. Psychoactive substances and certain behaviors, gaming, betting, spike the dopamine prediction error and assign super value to cue signals. The sight of a bottle, the smell of smoke, the road home become triggers for craving. Over time, incentive salience, wanting without pleasure, increases and prefrontal cortex control weakens. Tolerance and withdrawal symptoms reinforce the cycle. Effective strategies acknowledge biology. Substitution therapy and partial agonists, e.g. for opioid addiction, receptor antagonists, naltrexone for alcohol, varenicline for nicotine, as well as behavioral methods, contingent reinforcement, motivational interviewing, relapse prevention skills training. Triggers, stress, sleep deprivation, loneliness are manageable. Alternative rituals, social contracts, a new habit landscape reduce the likelihood of automatic activation. The goal is not just abstinence, but the restoration of quality of life. Fact 75th. Mindfulness meditation is a training of attention and attitude towards experiences, not an attempt to clear thoughts. Neurophysiologically, it enhances top-down regulation. Engagement of the dorsolateral prefrontal and anterior cingulate cortex increases. Amygdala reactivity to stress stimuli decreases, and the default mode network less frequently wanders. In the short term, attention stability and metacognition improve, the ability to notice when the mind wanders and gently return focus. For some individuals, heart rate variability also increases, a marker of autonomic flexibility. Long-term structural changes, as described by MRI data, have been observed, but the effect is small and depends on the method and dose of practice. Meditation is not a panacea. For acute psychotraumas or depression, it is better integrated with therapy rather than replacing it. Techniques with intense focus can temporarily increase anxiety in vulnerable individuals. Thus, it is important to choose the format, breathing, body scan, kindness, and duration. Fact 76. The hippocampus is not a flash drive, but a master of encoding differences and similarities. At the system's gate stands the dentate gyrus. It dilutes inputs into sparse representations, pattern separation, so that similar events, two similar intersections, two auditoriums, do not merge. Next, CA3 comes into play with its recurrent collaterals and pattern completion ability. It completes a whole scene from an incomplete prompt. CA1 compares the hippocampal draft with the cortical map of context, noting novelty and discrepancies. System consolidation is also based on this architecture. Over time, the event's index is transferred to broader cortical networks, and the hippocampus is needed less for semantics, although episodic vividness remains under its care for longer, hence the competing models of standard and multiple traces. At night, sharp waves, ripples, replay sequences, strengthening connections, and the presence of schemata, prior knowledge, accelerates the integration of new information if it fits into an already established network of meanings. Fact 77. Brain energy is a constant rush of pumps and mitochondria. Most ATP is used for the Na over K pumps work, which pushes out sodium and pulls potassium back after each spike, maintaining fragile membrane balance. Synapses are the most voracious zones. Dense mitochondrial farms supply ATP to vesicles and receptors. At rest, the brain consumes a lion's share of the body's glucose. This is why PET scans with 18F FDG highlight hot areas by metabolism, not by thoughts. Astrocytes store glycogen and, when the network speeds up, supply neurons with lactate, a quick fuel via the astrocyte neuron shuttle. During starvation, childhood, or on a ketogenic diet, ketone bodies save the day. Beta-hydroxybutyrate and acetoacetate cross the barrier via monocarboxylate transporters and burn in neuron mitochondria, partly explaining the diet's anticonvulsant effect. Hypoglycemia is dangerous not for the sweet tooth but for the computer. Attention and behavior drop, leading to seizures. The brain doesn't care where ATP comes from, but it needs a continuous supply. Fact 78. The vestibular system acts as our sixth sense, measuring rotation and acceleration. It comprises three semicircular canals oriented at right angles to each other, which detect angular accelerations. Endolymph within these canals inertia-drivenly deflects the cupula in the ampulla, bending the hair cells. The utricle and saccule, containing otoliths, calcium carbonate crystals, sense linear accelerations and gravity, providing the brain with information about down and the sensation of sliding. The vestibulo-ocular reflex maintains gaze on a target with millisecond latency, compensating for head microrotations, which is why the world doesn't swim when we walk. A conflict between signals from the canals and vision causes motion sickness and VR sickness. The brain cannot tolerate situations where the eyes say we are flying while the inner ear says we are sitting still. In neurology, benign paroxysmal positional vertigo is common. In this condition, otoliths dislodge into the posterior canal, and head turns trigger a brief storm of dizziness. Epley maneuvers reposition the crystals. Vestibular neuritis causes sudden rotational vertigo with nystagmus, which the brain learns to compensate for over weeks. In weightlessness, adaptation disrupts the system's calibrations, and upon returning to Earth, the ground may still feel like it's swaying. Fact 79th. Sign languages are complete natural languages with phonology, morphology, and syntax, not pantomime. The brain processes them using the same network principles as spoken language. In sign language users, areas homologous to Broca's and Wernicke's areas are active with left hemisphere dominance. The right hemisphere contributes to spatial grammar and the prosody of facial expressions. Early language environment is critical. Children deprived of access to any language during sensitive periods later experience persistent difficulties with abstractions, not due to hearing issues, but due to delayed language input. In deafness, visual and somatosensory channels partially take over the cortex normally occupied by sound. Cross-modal plasticity enhances sensitivity to movement and the periphery. After cochlear implantation, age and the duration of silence significantly impact the outcome. The earlier structured language, signed or spoken, is introduced, the easier network reorganization occurs. Sign plus speech bilingualism generates unique code blending phenomena, confirming the commonality of language control mechanisms. Fact 80. Amyotrophic lateral sclerosis, ALS, is a disease of the upper and lower motor neurons, where commands from the cortex to the muscles gradually become numb. Fasciculations and weakness appear. Tone becomes spastic. Speech becomes slurred with bulbar onset, and respiratory muscles tire. The pathology is heterogeneous. In some patients, frontotemporal behavioral and speech changes occur, linking ALS and FTD into one continuum. At the cellular level, TDP43 protein aggregates are often found, less commonly SOD1, C9orf72 mutations, and others. The diagnosis remains clinical, supported by EMG and exclusion of masks. Among medications, riluzole and some regimens with edaravone are proven to slow the progression. The basis of care is multidisciplinary teams, non-invasive ventilation, nutritional support, and assistive communication technologies, including eye tracking and brain-computer interfaces. Cognitive functions can be preserved for a long time, but caregiver fatigue and ethical choices are immense. Early planning and support allow for longer retention of a person's autonomy and voice. Fact 81. Engram is not a poetic image, but a working hypothesis suggesting that a specific memory is stored as an ensemble of neurons with strengthened connections. In rodents, these ensembles have been identified by tracking the activity of immediate early gene markers, like C-FOS, and tagged with molecular labels. Optogenetics is then applied. If light-sensitive channels are introduced during learning and these same cells are illuminated with blue light, the animal reproduces a conditioned response even in a safe environment. Conversely, suppressing these tags makes the memory difficult to retrieve. This is not erasing memory, as in movies. The trace often remains, but the path to it is blocked. Direct experiments on humans are not permissible, but indirect evidence, including high-precision stimulation, supports the idea of distributed memory cores. A key takeaway is that we recall not a file, but rather reassemble a pattern using key network nodes. Fact 82nd. Cerebrospinal fluid, a clear aquatorium of the brain, performs the impossible. It turns 1.5 kilograms of tissue into a weightless organ. It is produced by the vascular plexi of the ventricles, about half a liter daily, with a total volume of around 150 milliliters. The liquor is completely renewed several times a day. The path goes from the lateral ventricles through the cerebral aqueduct to the fourth ventricle, and then into the subarachnoid space, where the fluid washes the gyri and is absorbed into the venous sinuses. The liquor cushions impacts, equalizes the chemical environment, and participates in the removal of metabolites, especially during sleep when the glymphatic flow intensifies. Impaired circulation leads to hydrocephalus. In infants, an enlarged head. In adults, headaches, nausea, and disc edema. A special variant is normotensive hydrocephalus, with a triad of gait, memory, incontinence. Treatment involves shunting or endoscopic ventriculostomy, which restore drainage to the brain's internal waters. Fact 83. Alcohol is not a universal relaxant, but a multifaceted molecule that adjusts several neurochemical pathways simultaneously. Acutely, it enhances the activity of GABA-A receptors, inhibition, and blocks glutamate's NMDA receptors, excitation, leading to slurred speech, impaired coordination, and reduced anxiety. The dopaminergic reward system receives its bonus, prompting repetition. NMDA blockade in the hippocampus disrupts long-term potentiation, causing blackouts. Events occurred, but there is no episodic record. Chronic use alters receptor balance, and abrupt withdrawal releases overexcitation, seizures, tremors, delirium. The deficiency side is also dangerous. A lack of thiamine, vitamin B1, leads to Wernicke's encephalopathy, unsteadiness, confusion, eye movement disorders, and Korsakoff syndrome with severe amnesia and confabulations. The clinical rule is thiamine first, then glucose. A separate topic is fetal alcohol spectrum. Ethanol is particularly harmful to the developing brain. Fact 84th. Tools become an extension of the body, not metaphorically, but in the neurophysiology of peripersonal space. In the premotor and parietal areas, there are bimodal neurons. They are activated by both skin touch and by objects approaching the same zone in the field of vision. After short practice with a stick or forceps, their receptive fields genuinely expand. The brain starts to consider the tool's tip as the boundary of one's own space. This facilitates precise actions. A surgeon feels the needle deeper than the skin. A blind person sees the curb's unevenness with a cane, and a tennis player anticipates the ball with a racket as if it were their hand. Body illusions confirm the map's flexibility. Add synchronous touches and correct delay, and a virtual limb or VR avatar becomes incorporated into the scheme. However, the cost is vulnerability to conflicts. Signal mismatch causes discord and awkwardness until the network readjusts channel weights. Training makes the extended scheme stable and the skill economical. Fact 85th. When blind, the visual cortex does not freeze but takes on new responsibilities, an example of cross-modal plasticity. In congenitally blind individuals, the occipital regions actively participate in braille reading and in high-level language tasks, from morphology to semantics. Transcranial magnetic stimulation of the occiput in such people can temporarily impair tactile reading, direct evidence of reorganization. Scans show enhanced connections between somatosensory and auditory pathways and the occipital lobe, and white matter microstructure reflects long-term training of alternative channels. The developmental window is important. With early absence of visual input, the visual cortex flexibly consolidates new roles, whereas with later vision loss, the restructuring is more limited. This is not super hearing by default, but with systematic practice, outstanding skills emerge in echolocalization, voice recognition, and spatial thinking without pictures. The brain relies not on the type of cortex, but on the computational capabilities of the network and the demands of the environment. Fact 86th. Glutamate, the brain's primary excitatory neurotransmitter, becomes harmful when overactivated, leading to excitotoxicity. When blood stops supplying a tissue area during ischemia, membrane pumps cease functioning. Neurons depolarize, and glutamate accumulates in synapses. NMDA receptors lose their magnesium lock, allowing calcium to flood in and trigger a cascade. Proteases and lipases activate. Skeleton down and membranes break down, and mitochondria overload with free radicals. Astrocytes, which normally clear excess mediator via EAT1-2 transporters, fail during energy crises, completing the cycle. Similar mechanisms underlie damage in severe trauma, hypoglycemia, and certain seizure disorders. Blocking NMDA receptors might seem like a simple solution. However, in clinical practice, most direct antagonists have shown no sustained effect due to a narrow therapeutic window and side effects. They too aggressively block plasticity. Where possible, rapid restoration of blood flow, careful sedation, temperature, and metabolic control, supporting the network to weather the storm is what saves. Fact 87th. How does a neural network encode, by spike frequency or precise timing? In reality, the brain uses both languages. Rate code describes meaning by the average firing rate in a population, while temporal code embeds information in millisecond coincidences and oscillation phase. In the hippocampus, place cells exhibit phase precession. As they move through a field, spikes shift to an earlier phase of the theta rhythm, saving time for sequence encoding. At the learning level, STDP operates, spike timing dependent plasticity. A presynaptic discharge tens of milliseconds before a postsynaptic one strengthens the connection, while the reverse order weakens it. In the cortex, not individual cells but ensembles are important. A population vector predicts movement direction, and synchronized packets in the gamma band bind features into a single image. The network maintains a balance of excitation and inhibition at the edge of instability. This keeps it sensitive to subtle changes, avoiding chaos. In some experiments, this manifests as neural avalanches with power law distributions, a sign of operating in a critical regime. Fact 88th. Memory consolidation is a molecular drama occurring at the dendritic spine. Calcium, entering through NMDA receptors, opens the gates for long-term potentiation, activating KMK2 and cascades leading to CREB, the master transcription factor that switches on plasticity genes. However, proteins do not move randomly. A weak stimulus places a tag on the synapse, a synaptic tag, while a strong stimulus nearby triggers the synthesis of plasticity products, which are then captured by the tagged synapses. This tagging and capture mechanism links events in time. Many dendrites have their own ribosomes. They translate pre-delivered mRNAs locally, creating proteins on demand. The shape of the spine is important. Thin spines are labile and search, while mushroom-shaped spines are stable and hold memories longer. The epigenetic side, involving histone acetylation and DNA methylation, alters gene accessibility, explaining why a single learning event can have a lasting impact. On the other hand, there are mechanisms of long-term depression that tip the balance if a connection has more noise than signal. Fact 89th. Empathy is twofold. There's hot empathy, which means feeling another's pain, and cold empathy, which means understanding another's mind. The former relies on the anterior insula and anterior cingulate cortex. These nodes light up both when experiencing one's own pain and when observing another's pain, hence the term social pain, which highlights a partial overlap with physical pain. The latter, called mentalization, involves the temporoparietal junction and the medial prefrontal cortex, where we model beliefs and intentions. Neuromodulators intervene subtly. Endogenous opioids dampen both physical and social pain. Dopamine frames helping as valuable. Oxytocin sometimes enhances trust towards in-group members but doesn't guarantee benevolence. Context decides. Chronic loneliness shifts the default mode network and is linked to elevated inflammation markers, another thread in the immunity-sociality link. Compassion training and mindful attention practices show small but reproducible shifts in behavioral measures and the activity of relevant nodes, an example of the plasticity of the brain's social network. The 90th fact states that hemispheric dominance is a statistical pattern, not an absolute law. For the vast majority of right-handed individuals, speech is programmed in the left hemisphere, while left-handed people more often exhibit right hemisphere or bilateral organization. If the language zone is damaged early in life, there is a greater chance that the opposite hemisphere will take over its functions. Sensitive developmental windows and broad commissorial connections aid in this reorganization. In extreme cases, for children with intractable epilepsy, hemispherectomy is performed. One hemisphere is removed or functionally isolated. The brain, especially at a young age, can achieve surprisingly good autonomy, maintaining functions like gait, play, and basic speech, although deficits in fine motor and spatial skills may remain, depending on the affected side. In adults, plasticity is also possible, but the cost is higher and bypass routes are less well established. White matter, including the arcuate fasciculus, the inferior fronto-occipital fasciculus, and the corpus callosum, defines the migration channels for functions. The conclusion is straightforward and inspiring. Specialization exists, but the brain builds detours when the main highways are blocked. Fact 91. Wakefulness is maintained not by willpower, but by chemical latches, and one of the key ones is orexin, also known as hypocretin, a peptide from the lateral hypothalamus. Its neurons receive information from rhythms, energy, and emotions, and send broad projections to the noradrenergic, serotonergic, dopaminergic, and cholinergic systems, stabilizing the sleep-wake switch. When the orexin support breaks down, narcolepsy with cataplexy occurs. Wakefulness collapses. REM sleep elements invade reality, from sleep paralysis and hypnagogic imagery to sudden loss of muscle tone at the peak of laughter or joy. Such patients have low levels of orexin in their cerebrospinal fluid and the death of most corresponding neurons in their tissues. There are associations with immune markers. Treatment is symptomatic. Daytime sleep structure, stimulants like modafinil for wakefulness, and the sodium salt of oxybate for consolidating night sleep and controlling cataplexy. The essence is to restore system stability, which is normally provided by the orexin brace. Fact 92nd. The concept of number in the brain doesn't start with multiplication tables, but with approximate number, an ancient system for estimating quantity located in the parietal lobes, particularly in the intraparietal sulcus. We can instantly subitize 1 to 4 objects, after which counting and attention come into play. Sensitivity to quantity follows Weber's law. The larger the set, the less noticeable the relative increase. The symbolic level, involving digits and words, develops later and is linked to the frontoparietal loops and language areas, enabling the brain to associate symbols with quantities. Damage to the left inferior parietal region causes dyscalculia. The classic Gerstmann syndrome combines acalculation with agraphia, finger agnosia, and left-right disorientation, indicating the localization of these functions. In children, specific dyscalculia manifests as persistent difficulties with math facts and procedures despite intact intelligence. Explicit strategy instruction, modular task breakdown, and magnitude visualization are helpful. Mathematics is not an innate module, but a coalition of approximate number, attention, language, and working memory. Fact 93rd. Déjà vu is a brief crack in the sense of familiarity, where a new place feels like it has already been experienced. Neurobiologically, this spark is interpreted as a desynchronization between familiar and I remember. The perirhinal cortex is responsible for the sense of familiarity based on features, while the hippocampus handles the recall of an episode with context. If familiarity flares up without a complete episode recall, the brain might mark the situation as already happened, even without the ability to fill in the details, and the feeling quickly fades. In temporal lobe epilepsy, déjà vu often acts as an aura. A localized discharge in the medial temporal structures briefly highlights familiarity. There is also a mirror phenomenon, jamais vu, where the familiar suddenly feels alien, leading to feelings like, I think I've heard this, and I think I've seen this, for sounds and scenarios. These effects are not memory mysticism, but rather side effects of the prediction system, which saves time by marking patterns as previously encountered. Sometimes the mark is placed too generously, and we catch a false spark of the past without an archive. Fact 94th. Hallucinations are not exclusively a sign of psychosis. When sensory input is drastically reduced, the brain begins to self-complete the visual field. Charles Bonnet syndrome involves vivid, complex visual experiences in individuals with severe vision loss but intact reasoning. Faces, patterns, animals, which the person often recognizes as unreal. This is a release phenomenon. Visual areas deprived of normal afferent input increase their sensitivity and activate spontaneously, like a cortical phantom. Analogs exist in hearing, musical hallucinosis in hearing impairment, where melodies emerge in silence. In both cases, explaining the phenomenon's nature, improving sensory input, glasses, hearing aids, lighting, and reducing isolation are helpful. Sometimes gentle excitation modulators are used. A key distinction from delusions is that critical judgment is preserved. The person is aware of the source, and the goal is not to banish visions, but to restore the network's balance between input and internal noise, thereby eliminating the need for self-drawing. Fact 95th. Sleep spindles are short bursts of rhythm within the sigma frequency band, approximately 11 to 16 Hz. They appear during N2 sleep stage and reflect a dialogue between the thalamus and the cortex. Their generator is the thalamic reticular nucleus. Inhibitory neurons set the pulse, cortical networks respond in resonance, and a wave travels across the hemispheres. Spindles are linked to memory consolidation. The richer the spindle activity and the more precisely it is embedded within slow-wave phases, the better daytime traces are transferred from the hippocampus to the cortex, particularly factual knowledge and motor skills. Children have more spindles, and they are shorter. With age, the frequency and topography change. Individual differences correlate with learning performance. Benzodiazepines enlarge spindles but do not always improve memory. What matters is how the rhythms align with slow oscillations. In noisy environments, spindles help isolate the cortex from interference. The thalamus's door closes just enough to allow the network to repair connections without waking up from every sound. Fact 96th. The brain's wiring map, the connectome, is built piece by piece and resembles outer space on a microscopic scale. Complete diagrams exist for simple systems. The nematode, with its approximately 302 neurons, and the fruit fly larva, with several thousand cells. For mammals, only windows are currently available, millimeter-sized cubes of the cortex and retina, constructed from electron microscopic slices tens of nanometers thick. Machine vision stitches these bricks together, but segmentation errors still require human intervention. Even in these fragments, it's evident how uneven synapses are, how an axon makes dozens of branches, and how glial processes permeate everything, altering local exchange. A complete human connectome is a petabyte-scale task and will take years. Moreover, a single wiring diagram is insufficient. The strength and plasticity of contacts, modulators, rhythms, and metabolism are a dynamic overlay on the map. Connectomics promises a parts list, but to assemble behavior, operational instructions, and environmental context are also needed. Fact 77. Neurosurgery has learned to communicate with the brain directly in the operating room to preserve its functions. When removing tumors and epileptogenic foci near speech and motor areas, awake craniotomy is used. Under local anesthesia, the patient is asked to count, name pictures, and move their fingers while the surgeon stimulates areas of the cortex and white matter with gentle currents. Where the stimulus causes speech arrest, paraphasias, or weakness, a gentle bypass is performed. Dynamic cartography with every millimeter. This approach grew out of Penfield's classic works and has been refined. It turned out that language is scattered across a network, and not only cortical islands, but also tracts. The arcuate fasciculus, the inferior fronto-occipital fasciculus, are critical. An important detail is that each person's pattern is unique, and neuroplasticity allows for partial rewriting of functions long before and after surgery. The result is greater radicality with less neurological deficit and a living reminder. The brain is not an atlas map, but a flexible infrastructure. Fact 98 states that the idea of a taste map on the tongue, where sweet is supposedly at the front, bitter at the back, and salty and sour on the sides, is a myth from textbooks of the last century. In reality, receptors for all basic taste qualities are distributed across the entire surface of the tongue, differing only in their density and types. Umami is coded by T1R1/T1R3, sweet by T1R2/T1R3, and a large family of T2R receptors. Salty and sour sensations are linked to ion channels. The spiciness of chili peppers and the coolness of mint are not tastes, but rather the work of the trigeminal system for pain/temperature. Capsaicin opens TRPV1 and menthol opens TRPM8, creating illusions of warmth and coolness. The astringency of red wine is due to the mechanics of saliva and proteins, not a separate taste. Genetics alter thresholds. Variations in the TAS2R38 bitter receptor make some people supertasters who detect bitterness more finely and may avoid Brussels sprouts. Much of what we call taste is actually olfaction through the nasopharynx, which is why a cold diminishes a dish's nuances, even though the tongue remains in place. Fact 99th. The retina is an outward extension of the brain and the first processor of vision. Light that hits photoreceptors undergoes local processing through a cascade of horizontal and amacrine cells. These cells subtract background and emphasize contours, with lateral inhibition, for instance, creating Mach bands. Bipolar cells split signals into on and off channels for light and shadow. Some amacrine neurons provide sensitivity to movement direction. There are specialized ganglion cells, like looming detectors, that respond to approaching threats, and iPRGCs, sensitive to blue light, which adjusts circadian rhythms. The brain receives not raw photo data, but a compressed stream of features: where light changed, where edges move, their size and contrast. This also explains vulnerabilities. A rapid flicker can trick motion detectors. Flickering and unnatural light frequencies fatigue the filter network. The retina handles some recognition tasks before reaching the cortex, saving resources and making us faster than any camera without pre-processing. Fact 100. Memory champions prove that the brain loves structure. Their superpowers are not born from innate photographic recall, but from techniques like the method of loci, mental palaces where facts are placed in familiar spaces. fMRI shows that such individuals have more active navigation networks, the hippocampus and entorhinal cortex, and connections to visual areas. Numbers and lists gain the form of items on a route. It is encouraging that training novices with the same method quickly improves memory and changes activity patterns in the same nodes. The brain adopts the strategy as an add-on that doesn't require rare anatomy. In everyday life, this works for addresses, lectures, foreign language flashcards. The richer the scene, smells, and rhythm, the easier the indexing and retrieval. This doesn't negate limits. You can't cram infinity without errors, but it shows the main principle. Memory loves meaning, order, and roads you can travel back on.